Overtraining nutritional considerations. There are several aspects that are believed to be components of overtraining syndrome. So let's take a look at these. The first of which is the central fatigue hypothesis. During exercise, we decrease muscle glycogen. This leads to increases in oxidation of triglycerides and branched-chain amino acids, so that you rely more and more on these fuels since glycogen levels are being depleted. Particularly leucine, isoleucine, and valine, the branched-chain amino acids, these are utilized to a large extent during exercise. Free fatty acids are going to increase in blood because you're breaking apart a lot of triglyceride and releasing the glycerol and the fatty acids in that process. This causes also to decrease in the branched-chain amino acids. There's an accompanied release of tryptophan from albumin. So tryptophan is being released from albumin, and the concentration of tryptophan in blood actually increases. As we increase the concentration of tryptophan in blood, more crosses that blood-brain barrier and enters the brain. Tryptophan happens to be a precursor of serotonin. So the more tryptophan that you have entering the brain, the idea is that the more serotonin you're going to produce, which increases physiological and psychological fatigue. So in overtraining syndrome, the theory is that perhaps the central fatigue hypothesis is chronic, so it's persistent throughout the entire time that the athlete is experiencing overtraining syndrome. However, more research is definitely warranted as a possible player in overtraining syndrome. The immune system, as far as the needs are concerned here, prolonged and intense exercise may actually suppress the immune function. There seems to be a window of opportunity for an infection just after exercise because of this suppression in the immune system. There have also been reports of low glutamine levels, and glutamine seems to support the immune system. So perhaps glutamine supplementation may actually alleviate some of the immunosuppression that athletes are experiencing after exercise. As far as energy intake is concerned, obviously sufficient kilocalorie intake is paramount to match the athlete's need. And typically, somebody who's untrained will consume about 1,900 to 3,000 kilocalories per day, whereas athletes, depending upon how intense they're working, how often they're exercising, how long they're working for, anywhere from 3,500 to 12,000 kilocalories per day. So this is really, really important because sometimes with a busy schedule that an athlete has, with the traveling and the training and being at many different locations throughout a single day, it's sometimes difficult to actually consume, especially on the 12,000 calorie side, all those calories. So this is definitely something that we want to consider. And more importantly is that the calories that the athletes are consuming, we want to make sure we're focusing in on nutrient density. That is, that we're trying to pack in as many nutrients as possible per kilocalorie that the athlete is consuming. So, going off to having a McDonald's lunch, for example, or a dinner certainly isn't a very nutrient-dense food. We need to focus more on whole grains and fruits and vegetables and meats that are going to give the athlete everything that the athlete needs. As far as macronutrient intake is concerned, for carbohydrates, about 7 to 10 grams per kilogram per day of carbohydrates is what is recommended. About 1.5 to 2.0 grams per kilogram of body mass per day of protein, as well as less than 30% of total kilocalories from triglycerides or fats. As far as strategic eating is concerned, carbohydrates are recommended to be consumed 4 to 6 hours before they exercise. Light carbohydrate plus a protein snack about 30 to 60 minutes before exercise, about 50 grams of carbohydrate and 5 to 10 grams of protein. This is to alleviate any gastrointestinal distress that they may experience during exercise. About an hour after exercise, an hour of exercise, so they're into their training or they're into their competition, they should be consuming some glucose and electrolyte beverage to sustain glucose levels of carbohydrate in blood so that we are constantly delivering that glucose to the working muscle and hopefully spare glycogen a little bit. Carbohydrate and a protein consumption within 30 minutes after exercise is what's also recommended, about 1 gram per kilogram of carbohydrate, plus about 0.5 grams per kilogram of body mass of protein. A high carbohydrate meal within 2 hours following exercise is important in replenishing glycogen stores that have been depleted. Carbohydrate loading 2 to 3 days prior to the competitive event, which means that they'll pack in about an extra 200 to 300 grams per day of extra carbohydrate to make sure that we get glycogen supercompensation so that those glycogen levels are maxed out as much as possible. So this is going to promote glycogen resynthesis and, of course, anabolism. Carbohydrate protein supplements. Supplements can be very, very useful because they are nutrient dense. And so if you have an athlete that's having trouble consuming sufficient amount of kilocalories, sufficient amount of nutrients, then this may be the better way to go. It's easy to get and it's convenient to get those calories, especially nutrient dense calories. As far as glucose electrolyte drinks, these are important in sparing muscle glycogen. They also help prevent dehydration. So it blunts any increases in free fatty acid and thus free tryptophan. So maybe you can improve endurance capacity by reducing the whole central fatigue theory. This is particularly important in hot and humid environments. As far as amino acids are concerned, ingestion of branched-chain amino acids with glucose and electrolytes before and during exercise may actually improve the physiological and psychological responses to exercise. Hence, we are trying to reduce the central fatigue as a player in overtraining syndrome.